Please check the audio and video clarity. I'm going to check the messages in this. So please message in this group only in the chat box. Okay, so this will be, I'll be opening it only for purely interacting, so I'll know what you're typing. All okay? Thank you. Keep messaging here, so I'll not open this. I'll just keep this for checking the messages. So anything you have, you can please put the message here. There are still people who are joining, I think. With me. Anyway, I'll give you a brief introduction before I start the class so that people can still join if they want to join. 23 is public health, it's too less. Anyway, I'll do one thing. I'll give you my introduction and then I'll tell you about the subject also. That time will also be over for you. Okay, so as you can see, 1 second, I'll just close this off. Uh, yeah, so I have already introduced myself. Give you a brief introduction of myself. I am Dr. Manish and Kumar actually. Currently working as professor and head Department of Public Health Dentistry, okay, at a college by name Geetam Dental College, which I'm sure many of you have never heard also, but it's okay, don't worry. Andhra, it is very famous. It is in Vishakhapatnam, beautiful city. We are having on November 23rd, even T20 also. So it's in Andhra Pradesh. It's a coastal area. So from West Bengal, the coastal line starts. The whole thing is East Coast. Now, my phone number is already there in the group. You can see it. Okay, only after some time there will be a WhatsApp group, the doubts group also will be created in Telegram. Again, we'll have more interaction there, which I'm sure that you'll have doubts there. Okay, so I did my graduation from 97 to 2002. December I finished, and that I did from Davangere. Okay, from Bapuji, BCH. Okay, and then from 2003 June to 2006 June, I completed my masters from Cords Davangere. Okay, and now after I finished, from then till now, touchwood by God's grace, been in this field 17 years experience, or probably 17 and a half, both in, I'm completely in academics. I don't have my own practice, so completely into academics. Okay, personally, yes, the personal level, I am basically, my mother tongue is Gujarati. I'm a Gujarati, so I see that some of you are, might be Gujaratis, so I can speak Gujarati, my mother tongue. I can speak very fluent Hindi. I can speak very fluent English. I can speak Kannada, which is the official language in Karnataka, as well as since I am residing in Andhra Pradesh, I can speak Telugu also. I can speak 5 languages. Okay, not trying to boast, but just trying to tell you that I can speak 5 languages. So in case you want to communicate in your own any of these languages, beyond that, please. I don't know. I can speak these 5 languages. Now, my association with Dr. Amit Lall, who is the main owner of our institute, we goes back 17 years. We started our journey together. 2006 only we started our journey. He had just opened his institute in Delhi that time. That time he was associated with Target Educare, and from Target then we shifted to DBMCI. Then we realized that it's just not working out, and hence he came up with his own thing. So that's how the then it went to DBMCI. Then it went now currently it is BDS to MDS. This is what is our association. So every time that he had whatever has been this through thick and thin we've been together, so we have seen each other a lot, and so our association is much beyond only an coaching institute. So we have got a lot of common things also. So this is about briefly about me. In case if you have joined now, let me now jump to my subject now. Nightmare subject for entrance preparation. Most of you have absolutely uh, no clue how exactly the whole entrance works for public health. 6 years back, till the NEET came, that is till AIPG, sometimes there used to be 7 questions from community, sometimes 8 questions, sometimes 5, sometimes 15. There used to be not, the pattern was not there. But from the time NEET has come, whether you like it, you don't like it, every subject has been given due importance. Okay, so same for even public health. 15 marks will come for you from public health. Okay, there is no doubt about it. Now, if you look at the previous papers, look at the previous papers. Now, my subject public health dentistry, it is actually divided into two parts. We have public health, that is the medical side combinations, and we have dental public health, the dental part of it. Okay, so when it comes to entrance preparation, in public health, mandatory you have to know about epidemiology. There are so many questions on epidemiology. Maximum questions will come from epidemiology, biostatistics, screening. Okay, of late, even levels of prevention also. Levels of prevention also. Okay. On the other hand, in the dental side, maximum questions come from fluorides, followed by indices. Okay. Then followed by of late. Now we can include even health education also here. Of late, even here, they are asking a lot of evaluation questions. They are asking degrees of supervision for auxiliaries. They are asking questions on survey procedures. Okay, each of these topics will be covered. Apart from that, of course, the whole syllabus will be covered for you from MCQ point of view. Okay, you don't have to worry about it. Now, I am also human being, so there are chances that there might be some topics which I would not have. Now there are, before only I will tell you of now, that there are some topics which I never touch, okay, which I expect you to read on your own. I will give you the information and the material about the same, but I expect you to read on your own. Any doubts, of course, please feel free to put it in the group. You don't have to worry, I will solve it. That is now you know I have OCD, so the moment a message pops up for a doubt, I will solve it for you. Don't worry about it. The topics which I expect you to read on your own is biomedical waste management. Okay, biomedical waste management. I also expect you to read on your own Carey's activity tests. Again, don't worry. If you have doubts, please feel free to ask in this. Okay, then I also expect you to read IDA members, which in this I have thought I will teach you. If you see the schedule of community, I have given it in that. Okay, so I will teach you this time, but just in case these 3 chapters you expect you to read on your own. As I said, don't worry. In case you have doubt, please feel free to ask. Okay. Now, how many of you have joined? Can I start the official class now? 44. Okay. 44 students. Should I start the class now? So today we'll start with epidemiology. As you can see the schedule. So can I start the class? Trust me, it's a nightmare. Public health. When you actually open and try to read on your own, you will not be able to do it. So please tell your friends that it's not going to be easy. Okay. Epidemiology. So let's start. Okay. Thank you all for your confirmation to start, affirmation to start. So let us start with epidemiology. First chapter. Now we are going to be together for the next 10 days. Till 29th, we are going to be together 12 days because alternate day classes are there. So epidemiology. So epi means upon, demos means people, logos means to study. So epi means upon, demo means people, and logos means to study. So that means any study that is conducted on human beings, we call it as epidemiology. Okay, basic. Now coming to the MCQ point of view, first MCQ that comes here is the components. Components of epidemiology. Okay, there are three components. Okay, the first component is called as disease frequency. Second component is called as disease distribution. And the third one is called as determinants of disease. We will see each one of them so that it becomes easy for you, to understand how does it work. Okay, so the first one is the first one is disease frequency. Disease frequency. There are two meanings for this disease word frequency of disease. There are two meanings. The first meaning is, see, understand that you are an epidemiologist. Okay, first you have to imagine yourself slightly, picturize yourself that you are an epidemiologist. Okay, you have gone to a place, village, for example. You've gone to a village and you are a dentist, dental epidemiologist. You are what we call it as oral epidemiologist. Okay, you have gone there to find out in that village how many are suffering from dental disease. Let us say take caries, simple. How many are suffering from caries in that village? Okay, that is all my thing to you. So you understand that. So when you go to village, you will see how many are suffering from the disease. How many are suffering from, example, this is dental caries in that community or village. Okay. So when you find out how many, there's a specific word used for it, and that word is called as magnitude of the disease. Very important, this word, magnitude of the disease. That means total number of population who are suffering from the disease. Okay, this is the first meaning. It is also called as proportion of population affected. Proportion of population affected. So these both are used, magnitude as well as a proportion. Till this epidemiology chapter gets over, whenever you hear this word, magnitude proportion, your mind should go total number of cases. That is given by nothing but prevalence. How many are suffering? This is what is called as prevalence. So whenever you hear magnitude or whenever you hear the word proportion, till tomorrow afternoon, when I'm going to end the chapter epidemiology, magnitude proportion, whenever you hear, think about prevalence, prevalence, prevalence. Okay, that means total number of people who are suffering from the disease in question. Okay, now that is called disease frequency. I told you there are two meanings for it. The other meaning for disease frequency is how frequently one disease is attacking a population. Does the disease come every year, yearly once? We have no yearly ones. We have seasonal trends. So in the summer season, you will find GI disorders. In the winter season, you have respiratory disorders. Now winter is going to start, isn't it? In the rainy season, because of stagnation of water, we have a lot of mosquito breeding infections like dengue, chikungunya, malaria, isn't it? So does the disease have attack the same population yearly once, or does it come monthly once, or does it come weekly once? Like road accidents are more on the weekends because more people come on the road. Okay, so does the disease attack daily? Like COVID used to happen every day, new cases were coming. You want to find out how frequently the disease is attacking a population. Simple definition of frequency, isn't it? So that there are two meanings for it. One is to find out the magnitude or proportion of the disease affected. Another is how frequently the disease is attacking the population. Okay. Now the the second is distribution of disease. Disease distribution. Disease distribution. That's the second component. What do you mean by that? So when you went to that village, or a community, you saw that there were people of different backgrounds. Some were children, some were adults, some were males, some were females, some were belonging to rich economic status, some were poor economic status, isn't it? So the disease is not uniformly distributed across the population, isn't it? So what happens there is what you are encountering is a heterogeneous population. You have when you go to a village, you encounter a heterogeneous population. Heterogeneous. That means people from different backgrounds. Now the idea is you want to find out, does the disease have age difference? Does some particular age will cause more disease? Does some particular gender will cause disease? Is their oral hygiene habits? Some might be using toothbrush, some might be using fingers, some might be using tatum, isn't it? Socioeconomic status, is it playing a role? Or some diet is playing a role? What you're doing here is basically you are this large heterogeneous population, you are breaking them off into small homogeneous groups. Okay, so this is called as strata. Each small groups are called as strata. Each okay, and this type of sampling is called as stratified sampling. Why do we need to know? So that it will throw light on the risk factors. Converting the large heterogeneous population into small homogeneous groups called as strata. Strata means group. Okay, called as strata. So this is called as stratified sampling, converting a large heterogeneous population to small homogeneous group because each of them is an individual risk factor for dental caries, which I'm sure you are aware of, isn't it? So now what I'm trying to say is that what I'm saying is that descriptive epidemiology, descriptive epidemiology, it's a type of epidemiology. We'll go for the classification later part of the day, don't worry. So descriptive epidemiology will give you disease frequency and it will also give you disease distribution. Disease distribution. Okay. Now next comes determinants of disease. Determinants are cause of disease. Okay. Why should you know the cause of a disease? Okay. See, don't think that all these are very simple and it's easy to understand. There is a reason why this is being taught because I'm trying to make a chain of flow of thoughts for you. Okay. You will understand as we go progress in the lecture. Don't worry. All these are very important. Okay. So why should you know the cause of a disease? Let us say you are sitting in your oral medicine department. You're sitting in oral medicine department. You come across a patient, okay, who gives you a history of patient complaints of pain in upper right back tooth. Okay, he also gives you a history that 6 months back, 6 months back, same tooth, there was filling done. Okay, so there is pain, and the patient says that 6 months back, same tooth he has undergone filling. When the tooth you examine, so on examination, when the tooth is examined by you, you see that on that particular tooth there is overhanging restoration. There is a overhanging restoration. Now, there are two options for you. Put the patient on painkiller and send back, or refer them to endo for re-restoration. Which is better? Logic, no? Very easy. It is the re-restoration. Why? Because until you remove the cause, the disease is not going to stop. It is going to keep coming back. Logic, no? Isn't it? That is the reason why I said you need to know the cause of the disease. Then how do you apply this in our field? How do you apply this in community dentistry? Now let us say you are appointed, or rather you will go to a school. Okay, you will go to a school and check their caries status. You will go to a school and check their caries status. Okay, and you find that the DMFT, mean means average DMFT of every child is 4. This is in the year 2023. Okay, you've gone to a school, you've checked the queries using the index DMFT, and you found the score to be 4. Okay, now the school authorities tell you, Doctor, you have to do something, try to reduce the caries in our children. You say, okay, let's try. So what you do is you plan for 2 years fluoride mouth rinse program, which I'm sure you have heard about it. So fluoride is preventive against caries, isn't it? So fluoride mouth rinse program for 2 years you plan. Okay. After 2 years, when you re-examine to see whether your fluoride mouth rinse has reduced the caries or not, you have to evaluate it, isn't it? So when you evaluate it after 2 years, that is in the year 2025, now the DMFT, instead of decreasing, let us say it became 6. It became 6. So then you are breaking your head now. What the hell happened? Why did it not happen? So there are two interpretations here. There are two. There is what I was trying to tell you. There are the interpretation here is first is your the cause was not removed, hence the caries kept on increasing. Okay, cause not identified and not removed. So since you did not remove the cause, probably in that group, diet was more important. So you should have gone for dietary control rather than this. Logic, no? Oh. And the second one is that you gave fluoride mouth rinse program, which is an effective preventive agent. It was found to be not effective. So preventive agent not effective against controlling disease. So there are two interpretations. Now, what is you have to understand one more thing here. What exactly is happening here? This is all happening because of a process called as incidence, which again we are going to go in detail. So what exactly is incidence? Incidence is new cases that have come. How did you get new cases? So in this example, 6 minus 4 is equal to 2. There were two new cases. That means two new teeth per child have increased. Okay, isn't it? So to calculate the incidence, you have to do follow up of the same group. You do follow up of same group. Okay, only then will you be able to calculate the new cases. Follow up of same group. Only when you do will you be able to calculate the incidence. If you do not do follow up, you will not know new cases have formed or no. Logic, no? Isn't it? So if you just leave it like that, you will not realize only that new cases have developed or not. Okay. Now this is about the three things. Now the last disease, determinants of disease, comes under determinants or to find out the cause. Determinants of disease, also called as cause, it can be found out by conducting analytical epidemiology. Again, different type of epidemiology which will go in detail in some time. So to find out the cause, analytical epidemiology is used. Okay, right. And so far, any doubts, wait for you, or if you are still listening, all of you, or you have left, any doubts are there for you so far? Any doubts are there? Because I'm going to raise the bar now. I'm going to go in next level. That's right. Any doubts are there? Clear? Okay. No problem. Okay. Next comes tools of measurement. This is also a very important MCQ. Okay. Tools of measurement in epidemiology. Okay, there are three tools. The first tool is called as rate. Okay, the definition is occurrence of any particular event in a particular population. Okay, occurrence of any particular event in a particular population during a given defined time period. Okay, so there are three important words. So some event is happening in one particular population at a particular time period, what we call it as a rate. So some events is happening in a particular population at a particular time. So there are three keywords here. That is what is called as a rate. There are so many examples and MCQs here involved. Let us go one by one now. So remember, incidence is a incidence is a rate. Okay, incidence is a rate. The other important rates are infant mortality rate. Infant mortality rate. What we call it as IMR. Now I am sure that each one of you are aware that mortality means death. Mortality means death. Infant age group is 0 to 1 years. That means you are trying to find out infant is 0 to 1 years. Okay, infant means 0 to 1 year. That means you want to find out in a particular community how many infants have died, and the age group is from the time the child is born till the child is 1 year. Okay, very important. Now, infant, there are so many MCQs in this. Okay, I'm going to go further in this only. So, infant mortality rate is the best indicator for a country's socio-economic status. How does it indicate? Tell me. Because if the infants are dying more, you know what is the main reason of deaths of infants? The main reason of deaths of infants is GI infection. Okay, GI infection, and that is diarrhea and vomitings. Now that is the reason why if you go to any government hospital and you can freely get ORS, oral rehydration solution, you can get it. Okay, ORS you can get it. The government is giving free now. Why? To prevent the deaths. Okay. If a country's IMR is very high, that means the government is not doing sufficient for the health of the society. That's why it is the best indicator for a country's socioeconomic status. Now there are again infant mortality. There are so as I said, it is 0 to 1 years, isn't it? So infant mortality is written like this. This is also one MCQ asked. Infant mortality rate. This is divided. So what is the age group? I said 0 to 1 years. This is split. Okay, this is split. So you have like this. Okay, if you can see on the screen, right? The first one is birth, then 7 days, then 28 days, and then lastly 365 days. Okay, birth 7 days, 28 days, 365 days. From birth to 7 days, it is called as early neonatal period. Early neonatal period. Okay, then from 7 days to 28 days, it is called as late neonatal period. Okay, then the third, from 28 days to 365 days, it is called as post neonatal period. Okay, then these two combined together, okay, that is from birth to 28, that is early neonatal and neonatal, they are together called as neonatal period. They are called as neonatal period. Okay, then there is one more MCQ in this again. So that means remember, from the child has to be born for you to start calculating infant mortality. The child is born dead, what we call it as stillbirth. Stillbirths are not included. This is what is MCQ. Please remember, stillbirths are stillbirths are not included under infant mortality rate. Remember this. Okay, there is one MCQ asked. Okay, stillbirths are not included under IMR. That means the child is born dead. Okay, so it's not included under IMR. Okay, now coming back here, there is something called as perinatal mortality rate. Okay, that is before the birth only it starts. Okay, it starts from before the birth. Okay, now it starts from 28 weeks of gestation. It starts from 28 weeks of gestation, and it includes it's from it is from 28 weeks up to 7 days. So this is called as perinatal mortality rate. It is from 28 weeks of gestation to 7 days. Now, perinatal mortality includes, this is what I wanted to tell you. Perinatal, this is one MCQ asked actually. Perinatal mortality rate includes 28 weeks of gestation, abortions, if it happens. Okay, then it includes stillbirths. It means the child is born dead. Birth up to 7 days. Okay, very important. This is okay. This is asked. So, what does perinatal mortality rate include? It includes all these things. Starts from 28 weeks of gestation. It also includes abortions, stillbirths, birth up to 7 days. Okay, this is asked. Okay, now I told you about infant mortality rate. This whole thing, whole picture started like that, isn't it? That is from 0 to 1 year. Then you have another important rate called as child death rate. Child death rate. This is to calculate the deaths in the age group of 1 to 4 years. 1 to 4 years. They have included another parameter called as child mortality rate, 0 to 5 years. It is given wrongly in pulse. Okay, don't worry. What I'm giving you is the correct information. I have proof. I have a standard textbook called as Park textbook, which is the most standard textbook followed by even the medical people also. Okay, so what I'm giving you is authentic information. Child death rate is 1 to 4 years, and child mortality is from 0 to 5 years. Okay, remember these age groups they have asked. Okay, then comes, this is about rate. Okay, then you have ratio, that is number 2. Ratio. In your childhood, when you were kids, you have heard about ratio. So whenever you hear the word ratio, your mind should divert towards numerator and denominator, isn't it? Your mind should divert towards numerator and denominator. Now generally what we say is that numerator is part of denominator, so denominator is a bigger number. Okay, and numerator is a part of denominator. But in ratio, the numerator and denominator are independent of each other. The numerator and denominator are independent of each other. Okay. Now, for example, number of school children affected with caries, whole thing divided by number of school children affected with gingivitis. So if you see, there are two variables here, caries and gingivitis. They are not part of each other. Now, prevalence. Prevalence is a ratio. Please remember, this is also given wrongly in your pulse. He has given it as a proportion. Technically, yes, prevalence is a proportion. I will tell you the definition of proportion, you'll understand. So, number 3 is proportion. Number 3 is proportion. Okay, proportion means the numerator is part of denominator. The numerator is part of denominator. Okay, and please remember, proportion is a special type of ratio. Hence, in the textbook Park, it is given it as ratio, and you're going to mark that only because that is what is expected from you. So, what is the example for proportion? Number of school children affected with dental caries, whole thing divided by number of school children examined. Number of school children examined. It is called as, so this is a proportion. Okay. Now these are the three types of tools of measurements in epidemiology. Any doubts are there for you? Rate, ratio, and proportion. Any doubts are there for you? Are you even understanding what I am teaching you all? Or please remember, all these are asked. All these are asked. No doubts? Okay. Okay. बहुत बढ़िया. चलिए आगे बढ़ते हैं. Okay. Next is very important. Prevalence and incidence. Okay. Prevalence and incidence. Very simple. Okay. Very simple. Yet many students don't understand the basic concepts of it. Prevalence and incidence. Caries, Payal Sharma. I have just given example. You can give any example. Okay, Dr. Payal. You can give caries, gingivitis, anything. Okay, caries divided by total number of children examined. Okay. Okay. First, let us go with prevalence. Okay, let us go with prevalence. What is prevalence? Prevalence is, it is the total number of cases. Now, whenever I ask this question to the students in Viva, okay, they will give me this answer only. Sir, it is the total number of cases. Okay, that includes both old plus new due to a particular disease. Due to a particular disease. Okay, it's always multiplied by 100. Multiplied by 100. So it is expressed in percentage. It is expressed in percentage. Okay. Now there are types of, Dr. Nandini, they are different. As I said, death and mortality are same. But child death rate and child mortality have been defined separately by the government of India, and hence we are going to follow the same thing that they have given. Child death rate is 1 to 4 years, and child mortality is 0 to 5 years. Okay. Okay. So there are different types of prevalences. The first prevalence is called as point prevalence. Okay, point prevalence. So how exactly is this prevalence calculated? Very simple. Okay, it's like a snapshot. It's like a camera. Okay, now you go to a village. As I told you, I give you example. You go to a village as a dental doctor, and you tell them in that village that I want everybody in the village to come out and show me your oral cavity. I will check and find out how many are suffering from dental caries. Okay, that is called as point prevalence. Today is 18th of November. As of today, how many are having caries? Okay, so some might be having caries from before only, old cases. Some might know only today because apparently they were all healthy, isn't it? Okay, let me give you another example to explain how prevalence is done. Let us think that Dr. Pooja, yes, they are same. Mortality and death are same. बट क्या करें, गवर्नमेंट ऑफ इंडिया ने ऐसा दिया है तो हम भी उसको ऐसे ही फॉलो करेंगे. ठीक है. Okay, coming to prevalence, how does it happen? Let us say you are a medical doctor, okay, and you have been appointed to find out, to go to the village, one particular village, and find out how many are suffering from hypertension. Okay, so you go to a village, your stethoscope, sphygmomanometer, everything you go there. Okay, and you ask everybody to come and check for blood pressure. Some will say that I'm already suffering from blood pressure and I'm under medication. So they become your old cases. Some and majority of them will say that, oh, we are perfectly all right, we are perfectly fine. Still, since you have come, we will check our blood pressure. So they will get it checked. Okay. And once they get it checked, they find the doctor will tell them, hey, you've got a very high BP, you are having hypertension. They are the new cases. Okay. So as on 18th, that's what is called point prevalence. It means occurrence of disease at a given point of time. At a given point of time, point as of today. Okay, then you have second one. The second one is called period prevalence. The second one is called as period prevalence. Okay, now here it is a period is given, not only one particular point. For example, occurrence of disease over a period of time. So there it is a point, here it is period. Okay, over a point of time, here it is period of time. Okay, so what exactly is happening in period of time? Now what will happen is that is you will take, for example, 1st Jan to 31st December 2023. Okay, now on the 1st Jan, when you went to the village, you found that as on 1st Jan, you found that there were 300 cases of hypertension. Already they were there, 300 cases. Okay, and when you go on 31st, on 31st, in this period, in this period, okay, another 100 new cases came. Then as on December 31st, the total caseload will be 400 cases of hypertension. So it includes both the new as well as old. Okay, whereas this new cases that you're seeing, that is your incidence. It is your incidence. Okay, so remember they are not the same. Incidence and period prevalence are not same. In incidence you will take into consideration only the new cases, whereas in period prevalence you are also adding the old cases. That is why it has become 400 cases. You understood this concept? Yes or no? All these are important. When you are solving MCQs, no, they will twist and ask. That is why I'm asking. Is it clear, this concept? If your concepts are clear, mark my words, you can solve any MCQ. Any doubt is there in this? Yes or no? Okay, super, super, super. Okay. Then comes, okay, then comes lifetime prevalence. Number three is lifetime prevalence. Number three is lifetime point prevalence. See, this is on 1st January, when you went to a village, you found 300 cases of hypertension, and hence this becomes point prevalence for 1st January. After 1 year, you go to the same place. Then you will find on 31st December, you are seeing instead of 300, you saw 400 prevalence. So this becomes a point prevalence of 31st December. From 300 became 400. That means 100 new cases came, no, isn't it? So in the 1 year, so the new cases is only incidence. Everything together, it is period prevalence. So this is the period prevalence. We're giving a period. Clear now? Is it clear now? Clear? Okay, okay, thank you. Okay. Lifetime prevalence, also called as experience. Experience. Now, to make you understand this, the correct example for this is the index DMFT. Okay, there are three components in DMFT index, which I'm sure that every one of you are good at it. Decayed teeth plus missing teeth plus filled teeth. Now, if you take this missing teeth and filled teeth, they are recorded only for reasons of dental caries. So, if the tooth is extracted due to periodontal disease or ortho reasons, we don't include under DMFT. If the tooth is filled for trauma or for prosthetic reasons or for wasting disease of teeth, again we don't include. So, we'll include only those missing teeth and filled teeth which have been done for dental caries. As simple as that, isn't it? So, point is, missing and filled are the patient's past. On the other hand, decay tooth. Today the patient is having decay, and hence this is patient's present. So when you include present and past of the patient's condition, it gives you experience. So point what I'm trying to tell you is DMFT gives you carries experience of a person. It gives you carries experience of a person. Very important. This is very important. Okay. Then I want to find out what is the carries prevalence. Now, this was for experience. No. So what is carries prevalence? Okay. Carries prevalence is decayed teeth only. I want to find out how many people are having decayed. I am not bothered about past, missing or filled. That is called as caries prevalence. So if the patient has, now the next one more MCQ for you, so that is caries experience is total DMT score. Caries prevalence is only decayed teeth. Now caries incidence means new cases which have come, isn't it? So new cases of caries developed, isn't it? That means yearly increment that have happened of the new cases, then it is called as, this is also asked, caries incidence means new cases of caries developed, that is yearly increment. All these are, kindly please understand, they are asked as MCQ many times. Okay, so yearly increment, because new cases have developed in the same group, you're doing a follow up, isn't it? So please understand experience, prevalence, incidence, they have asked this. Then comes next one is what are the uses of prevalence. What are the uses of prevalence? The first use is it is used to find out the magnitude of the disease in the population. Dr. Payal, it can be monthly also. Okay. Generally, incidence, no, we use it for yearly, but it can be monthly also. It depends on the investigator. Okay, Dr. Payal. So if you are investigating for every month you are doing follow up, then it is monthly increment. If you are doing a follow up every 6 months, half yearly like that. So it's nothing like that. But generally, we say incidence is measured by per year. Okay, to find out the magnitude of the disease in the population, I have already given you this, or proportion of population affected. Proportion of population affected. I have already told you. Remember the very first thing of the lecture, magnitude, proportion. So once you know how many are suffering from the disease, okay, how many are suffering from the disease, next what do? You as a doctor should plan treatment for them, what we call as program planning. So to prevalence is used for planning, administration, and implementation of health programs. Okay. Then what is the third one? The third one is it throws light on risk factors. It throws a light on Risk factors. Please remember, risk factors are different, causal factors are different. Okay, throws light on risk factors. Please understand the difference. Smoking is a risk factor for oral cancer. It is not a causal factor. Okay, HIV is a causative organism for AIDS. Okay, like that. Positive is more stronger than risk factor. Okay, remember that. Incidence gives causal factors because you're doing follow up, so you'll know. Okay, as we are doing, you'll get to know. It gives a more much better this thing. So that is what is incidence. So next is incidence. It is the total number of new cases due to a particular disease. So divided by population at risk multiplied by 1000. Please remember, do not multiply by 100. Incidence is never calculated in percentages, it's always multiplied by 100. When we go for relative risk and all, tomorrow, if time permits today or tomorrow morning, you'll again realize the importance of this. That's right. Okay. So, what are the uses of these incidents? Why do you want to know the new cases? So, the uses of incidents. Again, if you remember the first part of the lecture, it is used to find out the etiology. Remember, I told you probably we were targeting dental caries with the help of fluoride mouth rinse program. We should have done diet. So, it is used for finding the etiology of the disease. Cause, very important. Etiology of the disease. Number two, it is used to control the disease. So once you know the etiology, you can control the disease spread. Logic now. That is how they found out about COVID also. So once they realized that it is airborne, mask was the only option. We used to control the disease. Then one more was it is used to find out. It is used to find out uh, yeah, the effectiveness of efficacy of preventive and therapeutic agents. This I have already told you that we found out that our uh, this what you said fluoride Motrin's program was not effective. Remember, so it is used to find out the efficacy of preventive and therapeutic agents. Then very important, very simple relationship between incidence and prevalence. Okay, so P is equal to I into D, where D is the duration. Okay, so as point is as the duration increases, prevalence will increase. That means prevalence is always going to be high in chronic conditions, isn't it? Because duration is more in chronic conditions, hypertension, diabetes, mental disorders, drug addiction, smoking, all these are chronic conditions. All everywhere you have more prevalence because of this relationship. Other way, see the other way, if you see the other way, it is incidence is equal to P divided by D. Simple mathematics, isn't it? So as the duration decreases, incidence will increase. It happens in acute conditions. It happens in, so you will see more incidents in acute conditions. there is one MCQ. Okay, there is an MCQ like this only. It says that incidence is high. Incidence is high when the disease is highly fatal or the disease is easily curable. So incidence will be high only in these two conditions. Why? Because the duration is less. Okay. So incidence is high when the disease is highly fatal or easily curable. Okay. Remember, this is one MCQ asked. When is the incidence high compared to the prevalence? When you have a highly fatal disease or a easily curable disease, incidence higher. Okay. So this is about your incidence and prevalence. The next very important is classification of epidemiological studies. I'll give you a break after this. Don't worry. I know that it is too much for many of you. First time you are hearing so much conceptual in the subject, so it becomes overwhelming. I know it. So before I start, any doubts are there as of now for this till now? Any doubts are there till incidence and prevalence? No. Okay. Good, good children. Very good. Okay. चलिए पढ़ते हैं अभी. Classification of epidemiological studies. You broadly divide them into two types. Okay, you broadly divide them into two types. Okay, the first one is called as observation studies. After disease is highly fatal, what is written? Easily curable. Dr. Atreya. Disease is easily curable. The first one is observational, and other one is called as experimental, also called as intervention, also called as intervention. Okay, now what is the difference between observation and experimental? Observation epidemiological study says that you have to just observe, you should not intervene. Okay, patient is dying, मरने दो, आप कुछ नहीं करेंगे. This is what is called as an observation study. What is experimental? As an investigator, as a doctor, you will put something new in the patient's body. You are experimenting on them. You are intervening in their body, isn't it? So that's why it is called experimental or intervention. Okay. Now, observation studies are again broadly divided into two types. Okay. Let me write down properly for you. Okay. Yeah. Observation are divided into two types: descriptive epidemiology and analytical epidemiology. Descriptive and analytical. Descriptive epidemiology means you are describing the condition in a population. Okay, that's what's called description. Now, if I tell you to describe this pen that is I'm holding on my hand, you will say that sir, it is a black color. It writes on a you know pad and which we can see. So something like that. We are describing. So here in epidemiology, we describe the disease in the population. Does it have any time pattern, population, this person pattern or a population pattern? Does it have any yearly occurrence or does it have any geographical variation like that? Not describing. Why do you do all these things? So that you can formulate hypothesis. Okay, formulation of hypothesis is the main aim of descriptive epidemiology. This hypothesis that we have formulated about the disease, you will test it by conducting a analytical epidemiology. So in analytical epidemiology, you got again four types. Okay, in analytical, you got four types. The first one is called as case control. The second one is called as cohort. The third one is called as cross-sectional. The fourth one is called as ecological. Ecological. Case control is also called as case reference. Cohort is also called as follow-up study. Where did you use the word follow-up? Incidence. Remember, so cohort studies are also called as incidence studies, follow-up studies. Cross-sectional studies are also called as prevalence studies. So what is the aim of prevalence or a cross-sectional study? To find out what magnitude of the disease in the population or a proportion of population affected. Ecological study. They are also called as correlational. Okay. Now, when it comes to okay, these three case control, cohort, and cross sectional. Individuals are taken as units of study. Individuals are taken as units of study. That means each person is one unit. Okay, individual. Each person is one unit. On the other hand, for correlation study, population is taken as unit of study. Is taken as unit of study. Population is taken. What do you mean by population? A population of people who were given new drug, a population of doctors, a population of teachers with that. So one group is taken as one unit. Okay, so that's the difference between. Hence, ecological studies are the weakest study design. I will share with you tomorrow once the epidemiology end will come. No, that time again we will share about it. Okay. Now, next comes experimental. These are by far the best study designs, but very difficult to do it. There's always a catch, you see. So in experimental, under experimental, the first one is randomized controlled trial, RCT, randomized controlled trial. Here you need patients are units of patients are technology units because you see we will collect a group of patients. Okay, half of them will give the new drug, half of them will give the old drug. That is a typical randomized control trial, isn't it? So hence patients are taken as units of study. Then you have the next one, number two, field trials. Okay, healthy people are taken here. Example is vaccinations. So I hope you remember that you were given COVID vaccine or you have taken the COVID vaccine only when you were healthy, not when you were having the disease. Okay, right. Now next you have units of study. डॉक्टर निधि एक एक बंदा एक यूनिट होता है एक एक बंदा एक एक यूनिट होता है सैम्पलिंग यूनिट we say no. Okay, that is called as units of study. Okay, the third one is community trials. Here community is taken as unit of study. One community is taken as one unit. एक क्लासरूम फॉर एग्जांपल आप मान लीजिए आप फोर्थ ईयर बीडीएस में है, ठीक है, पूरा फोर्थ ईयर बीडीएस एक यूनिट, दैट इज इकोलॉजिकल स्टडी, लेकिन मैं हर एक बंदे को अलग अलग तरह के ट्रीट करूंगा तो इंडिविजुअल्स एज यूनिट ऑफ स्टडी. सिंपल ना, इजंट इट? एग्जांपल इज कम्युनिटी वाटर फ्लोरिडेशन trials. We will go about community water fluoridation trials later. Okay, so these are the three different types of experimental epidemiology. Okay, this classification is very important. Now, what is happening? There is one more MCQ here. There is one more MCQ here, and that MCQ is all the variables are under the control of investigator. All the variables are under the control of investigator in an experimental epidemiology. This is asked as an MCQ. So, how are the variables under the control of investigator? What do you mean by this? Now, let us say that I am doing a study. I am doing a randomized control trial. Okay, so I want to try the new drug, painkiller, a new painkiller only. So in one study, I will take only children. In another study, I will take only adults. In the third study, I will take only old age people. So age is the variable here, which is under my control. So I'm manipulating the age according to my convenience. Okay. Come to observation. Disease is happening. Whether it is attacking old people, adults, children, it is not in my hands. I'm just supposed to observe it. It is not under my control, isn't it? That's why this statement is used. All the variables are under the control of investigator and an experiment. This is a major difference between a. This is how experimental epidemiology is different from observational epidemiology. Okay. So let's take a small break and come for descriptive epidemiology. How much time do you want a break? First of all, did you understand what I have taught you? And how much time will you take a break for? 15 minutes, is it alright for you? Now it is 7:12. What time will you meet? What time will you meet? 7:30. Okay, okay. Dr. Vaishnavi, bit slow. इससे slow क्या जाऊं यार और? हो क्या है? This is the slowest I am going. Okay, I'll try my best. Don't worry. Okay. Last point, all the variables under the control of the investigator. Yes, basically, you can change your variable in an experimental technology. You can take in one study only adults, you can take only children. Okay, so it depends on you. But in observation trials, you cannot do that because you're just observing them. This is हो रहा है, doesn't make a difference to you. It should not make a difference. Adults are affected or children are affected. You just have to keep observing it. It's not in your control. Okay, hope it is clear now. Yeah. See you at 7:30 then. Can I start? Audio, video clear? Tomorrow morning class will be from 8:30. Okay, slightly early because I have to go pick up my daughter, and I have to be there by 12. So I have to wind up by 11:30 at any cost. Okay, so tomorrow I will write down here only. Don't miss it tomorrow for the simple reason that tomorrow is the most important in epidemiology. Today also it's important, but it's going to be much higher. AM, not PM. PM you'll be watching match in case you're interested in cricket. So tomorrow it will be from 8:30 to 11:30. Analytical epidemiology, experimental epidemiology, screening. That is the agenda for tomorrow. I actually wanted to finish up today only, but then some of you are saying that it is slightly faster, so we need to tone down a bit. Okay, I hope it's all right for you. Please message yes or no. Is it okay for you? 8:30 morning. Is it fine for you all? I'll message in the group also. Don't worry. But those who are attending right now, is it okay for you? Huh? Okay. Okay. Thank you. Right. So descriptive etymology. So basically, you are describing the disease. Okay. The point is you are describing the disease, how the disease is spread in the community. Okay. So there are steps for it. I will tell you. You don't have to. You just remember the steps names. I explain you each of them. Don't worry. First is defining the population under study. Defining the population under study. Number two is defining the disease under study. Number three is describing the disease according to time, place, and person. All your MCQs are here only. Okay, this is by far the most important step. We will go in detail in this only. Okay, the fourth step is measurement of exposure. The fifth step is comparison with known indices, and the last step is formulation of hypothesis. This is what I was trying to tell you, that the eventual aim of descriptive epidemiology is to formulate the hypothesis. Okay, let us go one by one now. As I said, the first two steps are only for theoretical, for you to understand how exactly does it work. Now, let us say that you have gone to a village. You've gone to a village uh, and trying to find out about dental caries as a dentist. Okay, so you need to define the population. So when you say you're defining the population, so when you go to the population, That population you are going to meet is a heterogeneous. Yes or no? Because people belong to different age groups, gender, they belong to different dietary patterns, oral hygiene habits will be different. Okay, personal habits will be different. So you are trying to link these factors to dental caries, right? So that population that you are seeing, you will subclassify them, stratify. That is what is called as the first step, defining the population under study. Number two is defining the disease under study. Now here we don't expect you to give or know this definition given by Schaefer, an infectious microbiological disease affecting the heart tissues, and no, we don't expect you to do that. Here you need to know something called as operational definition of the disease. Operational definition of the disease. Now, when I say operational definition, what do you mean by that? Operational definition means now when a patient is given to you and you're checking the oral cavity, when a, okay, at that time, you will see, you will see whether the patient has caries or not. So, what points do you keep in mind to say that the person is having dental caries? The patient should have on that particular tooth, the tooth should have discoloration, right? Catch point, right? A soft base, not hard base, soft base, or else the lesion should be obvious or the cavity should already be formed. So you keep these 4 points in the mind: black discoloration, catch point, soft yielding material at the base, and lastly the cavity should already be formed. So this is called an operational definition. You keep these points in mind to diagnose dental caries in that particular patient. This is an example. So for each disease, you will do like that. Periodontal disease, you will say that there should be either a pocket or epithelial attachment loss. Okay, pocket more than 4 mm, loss of attachment more than 4 mm, like that. Right. So you keep the operational definition. Once you have kept this criteria to diagnose dental caries or periodontal disease, you will stick to it till the end of the study. Right. Then you will describe the disease according to time, place, and person. This is where all your MCQs are there. Okay. So first, let us go with the time. So do you feel, or in your research you will have to find out, does the disease have, there are three types of fluctuations. Okay, does the disease have short term fluctuations, periodic fluctuations? You are trying to find out, okay, does the disease have short term fluctuation or periodic fluctuation, or does it have long term fluctuations? So there are different synonyms for each of them. Short term fluctuations are also called as epidemics. ऑपरेशनल डेफिनेशन यार, आप डायग्नोज करने के लिए डॉक्टर अंशिका, टू डायग्नोज डेंटल caries, what criteria do you keep in mind? So if a patient is given to you, you are examining in oral medicine, caries है या नहीं है, क्या पॉइंट्स याद रखोगे? उसको डिस्कलरेशन होना चाहिए दांत में, या फिर कैच पॉइंट होना चाहिए, there should be soft material at the base, or else there should be cavity already formed, isn't it? So this is what is called as operational definition. So long term fluctuations are also called as secular trends. Now let us go one by one now. First we'll go with epidemics. First we'll go with epidemic, or a short-term fluctuation. So many times this question is asked. Epidemics. Okay. So the definition of epidemic is occurrence of any disease more than the normal expectancy. More than the normal expectancy. Very, very, very important. So many times this is asked. Definition of epidemic. Okay. So what do you mean by this definition? More than normal expectancy. Let us say you are a medical doctor. Normally, you are seeing 4 to 5 cases of cholera every month. Normally, that is per month, 4 to 5. But if you start seeing 4 to 5 cases of cholera every single day, that means it is more than normal expectancy. Then you can say that cholera has now become an epidemic. Okay, more than normal expectancy. You can give like this example for every disease. Okay, every disease you can give, right? You can give example for malaria, tuberculosis, dengue, chikungunya, all communicable diseases will have their own, sometimes or the other they have become epidemic. Again, epidemics are of three types. Epidemics are of three types. First is common source epidemic. The second is propagated epidemic. And the third part is slow or modern epidemic. Okay, now let us go one by one now. Common source. Again, there are two types here. Okay, you have single point exposure and you have multiple point exposure. Okay. Now, what is a single point exposure? Common source. There is only one source, only one exposure. That's what is called as single point exposure. Okay. Now, when does it happen? Food poisoning. Let us say all of you have gone for a marriage, and for some reason, the food that is being served there has got contaminated or adulterated. So all of you have eaten that, and all of you will fall sick at the same time, and more or less you will recover. Only one exposure has happened. Hence, it is called single point exposure. So the curve is like this. There is only a single peak. Okay. So this is your rise of cases. Okay, and this is your fall. So there is only a single point, single peak. Okay. Examples for this are food poisoning. Okay, Bhopal gas tragedy. The tragedy happened only once. Bhopal gas tragedy, 1984. Watch Netflix. The railwayman has come based on Bhopal gas tragedy. Okay. Anyway, we'll come back to it later. All right. So food poisoning, Bhopal gas tragedy, single exposure. There will only be a single peak. Common source, same source, single exposure. Hence called common source, single point exposure. Let us go to the second one. The second one is common source, multiple point exposure. Common source, multiple point exposure. There will be a single source. For example, there is a village. Okay. For example, there is a village. In the middle of the village, there is a well. Okay. That well water is the source of drinking water for all the villagers. Okay. It's the source of our drinking water for everyone. Today, one family will drink. Okay. They will fall sick. Second day, one more family. Third day, one more family. So the source is only one. It is not changing. Okay. But multiple times people are getting exposed. Hence, you got multiple peaks. You got multiple peaks. The example for this is contaminated village. Contaminated well in a village. Well water in a village. So this is first family, second family, third family, so on. It keep happening, and eventually they will realize that the village water is contaminated, and it will start tapering down when they stop using it or they undergo for disinfection. Okay, so this is called common source multiple point exposure. On the other hand, you have propagated epidemic. Okay, you got propagated epidemic. Okay, propagation means transmission. Propagation, the literal meaning of propagation is a transmission. How is the disease transmitted? How is the disease transmitted? Airborne, airborne. Okay, it can be transmitted from vector, that is your mosquito bite, malaria, isn't it? Dengue, chikungunya, vector borne, isn't it? So it transmits. Now, COVID also is an example of propagation. Okay, COVID also is an example. So in this also you will have multiple peaks like this. In propagated also you'll have multiple peaks. Then how do you differentiate between propagated epidemic and multiple point? The difference is there is only one source. Common source, multiple point. There is only one source. Contaminated village well water. Whereas in propagated, if you remember COVID, from one person it will split to the second. The second person will get infected. He will spread it to the third person. So the source keeps changing, isn't it? So hence you will have multiple peaks here also. The ideal example for this and for you to understand is COVID, tuberculosis, AIDS. All these are propagated epidemics. Okay, so AIDS, one sexual worker will be having AIDS, transmits to one customer. That customer sleeps with his or her partner, transmits to that. The source keeps changing. Hence, it is propagation, transmission. So it can be sexually born, bloodborne, airborne, arthropod vector to humans, anything. So the source keeps changing. Right? Then, what is the example of slow or modern epidemic? Slowly, certain modern diseases are reaching the proportion of epidemic. The examples are all your modern diseases: hypertension, diabetes, mental disorders. All these are modern diseases, but they are slowly reaching the proportion of an epidemic. Okay. What are all the MCQs for you? This is an MCQ they have asked. Propagated, they have asked. They have asked a single point as MCQ. They have asked for multiple point also. Okay, remember the graphs. They have asked, given the diagram also, and they have asked you to identify. Okay, so this is about epidemic. Okay, this is about epidemic. This short-term fluctuation, epidemic, occurrence of any disease more than the normal expectancy. Then you've got periodic fluctuation. Then you've got periodic fluctuation. As the word itself says, periodic, that means at a specific time it will happen. You have again two types. You've got seasonal trends and you've got cyclical trends. Seasonal trend is very easy. No MCQs will come, but for your general information, what is a seasonal trend? Based on the seasons. Based on the seasons, the diseases will change their pattern. What is written about DM? Hypertension. Dr. Nidhi, hypertension. Hypertension, diabetes mellitus, mental disorders. Okay. What is a seasonal trend? What is a seasonal trend? Seasonal trend means based on the season, the diseases will change their pattern, isn't it? So I gave you this example that time also when I was taking disease frequency. In summer season, you will have GI disorders. In the rainy season, because of water stagnation, malaria, chikungunya, dengue. And in the winter season, because of the colder climate, respiratory disorders. Seasonal trends. Don't worry, nothing will come. What they will ask is cyclical trends. Now, when you talk about cyclical trends, when you talk about cyclical trends, okay, there are before the it's a fact. What I'm telling you right now, it's a fact. Before the pre-vaccination era, okay, in the pre-vaccination era, what used to happen was, okay, measles used to attack a population every 2 to 3 years. Every 2 to 3 years. Rubella used to attack population every 6 to 9 years. Every 6 to 9 years. Now, why does it happen in cycles like this? Every 2 3 years, measles is coming. Every 6 to 9 years, rubella is coming. So basically, it's a cycle. Why is it happening like this? To explain this phenomenon, okay? Sorry. To explain this phenomenon of cyclical trend, okay? To explain to explain this phenomenon of cyclical trend, there is one particular word is used in the literature, and that word is called as herd immunity. It is called as herd immunity. What do you mean by herd? Herd means group. The literal meaning, if you see Google search it, herd means group. So what is the group doing here? Now, from your childhood, you have attended thousands of lecture classes. Yes or no? Thousands of lecture classes. In your classes, many times your teacher will ask what she has taken in the previous class, or what topic, some question about the topic which was covered in the previous year also. Very common, they do ask. Some students who are especially in the front benchers, no, they will answer. The teacher will think, everybody is knowing this concept. So then she will go ahead with the next step. Okay. Same thing happens in herd. Majority in a particular community, okay, they will have immunity developed for that disease. The remaining, they will give protection to the remaining people. Okay. Are you understanding? So this is called herd immunity. Approximately 55 to 60% will be immune to the disease, and this 55 to 60% will give protection to the remaining 40 to 45%. When COVID happened, when COVID happened, the first wave, the government was trying to vaccinate as much as possible. Why? To achieve herd immunity. If everybody is immune, okay, or if majority of the population is immune, the virus cannot attack. The spread reduces drastically. That was the logic. So, in herd immunity, the main aim is prevention of transmission of disease by development of immunity. Now, every 2 to 3 years, when measles is to attack, 55 to 60% of them will become immune to it. They'll give protection. Again, the virus will attack after 2 to 3 years with a new mutated gene. That is why now they're again saying that COVID might come with a new gene again, because the virus undergoes mutation very fast. Rubella also. Okay. So 6 to 9 years, herd immunity is to work. And again, after 6 to 9 years, one more rubella attack is to happen. Again, there will be herd immunity developed, because our body also fights back. Okay. So point is, in herd immunity, 55 to 60% of the population is protecting or giving protection to the remaining 40 to 45%. The logic is to prevent transmission of disease by development of immunity among the majority. Okay, this is herd immunity. Remember this, they have asked this also as MCQ. Then the last thing in this is long-term trends. Long-term fluctuations, also called as secular trends. Okay, long-term trends. What do you mean by long-term trends? Now, diseases, no, they change their patterns. Okay, with time, diseases will also change. Okay, 120 years back, the major reason for death was communicable diseases. Okay, 120 years back. Majority of the deaths were because of communicable disease, because there was no public health. Sanitation was horrible, no water purification, nothing. So that's why people used to die. Now, the major reason for death is non-communicable diseases. The diseases change their pattern. So this is what is called as long-term fluctuation, change in the direction of diseases, rise or fall over a period of time. Over a period of time. Also, they have asked what is secular trends. Okay. Now that means what happens is here. What happens is in a graphic way to see it. 2005, 2010, 2015, 2020. Whether the disease will rise over a period of time or it will fall over a period of time or it will rise and then just stabilize it like this. So rise or fall of the disease over a period of time. Now you have to understand that here time, these four, these time is the variable here. Time is the variable here. And whenever you have a graph with time as the variable, okay, when you have time as the variable, then we use a specific graph which we will deal about it on Tuesday. I will ask you this question again. So for depicting, bottom line is for depicting secular trends where time is the variable, we use a graph called as line graph. Okay, so specifically to depict secular trends, we use line graph. Okay, this is one of the MCQ. Okay, so depict secular trends, which graph is used? Line graph. Okay, so this is about time distribution or time variation, how the diseases change over short-term fluctuation, long-term fluctuation, periodic fluctuation. Any doubts are there for you as of now? Any doubts are there? If no means I will go towards place. Place, how the place will change. Any doubts are there? No? Okay, perfect, perfect. Okay, now coming to herd immunity again. Dr. Payal, just imagine that you are in the classroom. अब कुछ बच्चे आंसर करते हैं तो टीचर क्या समझती है? सबको आता है, छोड़ दो. उसी तरह से वायरस को भी आप बेसिकली बेवकूफ बना रहे हो. Majority are immune, so the virus is not able to penetrate because herd immunity has come into it. So basically, the herd immunity is you are giving protection to the remaining who are still unprotected. That's the logic. Okay, right. So the next is place variation. How does the disease vary? Dr. Anshika, the diseases will change their patterns over a period of time. Okay, over a period of time. The diseases that were there 100 years back, now we don't have. Now what we have, we are not there 100 years back. The diseases will keep fluctuating. That is what is called long-term fluctuation. Now we say no, वक्त के साथ अपने आप को बदलना चाहिए. 30 years back, I had never thought that my whole life will be in mobile. 30 years back, you were not even born. None of you are born. 93 I'm talking about, when I was still in my school. Imagine. Okay. So now technology changed. Okay. I had never thought that I will sit at my home, comfort of my home, take lecture for you. You sitting at your own home, listening to the lecture, understanding everything. So this is what is called long-term fluctuation. AI is coming now, majorly, isn't it? So things change over a period of time. That is what is called long-term fluctuation. Yes, Dr. Vaishnavi, you're correct. In single point exposure, the source is single. Food poisoning, Bhopal gas tragedy. Dr. Pooja, you have asked me what is single point exposure. Single point exposure is very simple. There is only one exposure. Food poisoning. Take the simplest example now. You've gone for a marriage, you've gone for some function, the food is adulterated. All the people who ate that food have got sick. Isn't it? Single exposure, single point, single peak will be there. You'll require more or less symptom. You will not die because of one, three, four times if you have loose motions. Isn't it? So recovery also will happen. Okay. Any other doubts? Any other doubts? Can I go ahead with the place variation? Any other doubts? No? Okay, right. Place variation. Now, by now, I am sure that each one of you have understood that your degree is not valid in the Western countries. Correct, right? Your degree is not valid. Yours, no, mine also. मेरा कोई तोप डिग्री नहीं है. BDS MDS is not valid there. Why is it not valid? Why is it not valid? Because we are trained as doctors for the health situation of our country. There, the health situation is different. So the way you are trained is different. Similarly, every place will have its own variation. The first one in that is in the place variation. It is called as international variation. It is called as international variation. Now, research has shown that cancer of oral cavity, example is given in your textbook also. Cancer of oral cavity is most commonly seen in Southeast Asia. Cancer of stomach is seen more among Japan. Cancer of cervix is seen more among US women. So these are international variations. Okay, at this point of time, when we are talking about international variations, one particular term you should know, and that is pandemic. That is pandemic. Pan. Pan means throughout. Don't think pan means a tawa. That also is there. Tawa bhi hai. लेकिन यहाँ पे the meaning is throughout. That means what WHO says is that more than two regions or countries having same disease prevalence, then that disease has become a pandemic. HIV in its time was a pandemic. COVID is a pandemic. Okay, diabetes to some extent is a pandemic, even though it's not a communicable disease, but it is a pandemic seen in many countries, and more or less the prevalence is same. So having two or three countries, same disease prevalence, you call it as a pandemic. Okay, now national. This is about international variation. Now we need to know about national variation. So within our own country, do we have certain areas where if a person is coming from that area, we can expect them to have the disease? Definitely. The ideal example for this is fluorosis. Fluorosis. Okay. Then goiter, letharism. Okay. All these are called as endemic diseases. These are called as endemic diseases. Then the question comes, then what is endemic? What is endemic? Endemic means a disease is constantly present, constantly present in one particular geographical area or location. That means if a person is coming from Telangana, Andhra Pradesh, Gujarat, Rajasthan, and on examination you see white intrinsic stains or yellowish brown intrinsic stains. Excuse me. If you see these stains, yellowish brown stains, you can expect that the individual is having fluorosis. Why? Because that disease is constantly present in that geographical location. Why these areas? Gujarat, Rajasthan, Telangana, Andhra Pradesh. These four states, okay, have fluoride content more than 1 ppm. Okay. Also, the northern Karnataka, which is a border of Telangana and Andhra, Challikere, one place is there. I don't know how many of you are from Karnataka and Andhra border, and have you heard about this place or not? It's called Challikere. Okay, that place has got, like, recently I was driving down from Visakhapatnam to Chikmagalur. On the way back, I had to stop there to fill fuel. And August month, when Ganesh Chaturthi was there, people had come, small kids had come. Every single kid had fluorosis. Every single kid. That is a fluoride belt area. Okay, that means the disease is constantly present in one particular geographical area. We call it as endemic. Okay, very commonly asked as MCQ also, this particular thing, endemic. Okay, then comes, this is about national variation. Then you have got rural urban variation. Rural urban variation. Now, generally, not always, but generally, we say that we observe in the rural areas more communicable diseases are there. Okay, and in the urban areas, we mainly find non-communicable diseases, hypertension, diabetes, mental disorders, air pollution. All these we find mainly in the urban area. Generally, don't find them in the rural areas. Okay, so no MCQs are there in this. Don't worry. And then you've got local variation. You've got local variation. To explain local variation, okay, just imagine the time of COVID. Okay, we had lockdown. If you remember, March 2020, I think 22nd March, the lockdown started for 2 months. In that, especially in the first wave, the 2 months followed by the first wave of COVID, in an apartment building, if one person had a case, that apartment was sealed and it was called as a red zone. Okay, in some areas there were no cases only. Those areas were called as green zone. In some areas where the patients were recovering almost, okay, after quarantining, they were called as orange zones. That means the disease was not spread across whole of that particular city. So there are certain pockets of the areas where the disease was there. That is what is called as local variation. And to explain this local variation, we have to know something to depict this in a graph form. A type of graph is used, diagram is used called as spot map diagram. Okay, to depict local variations, spot map diagram is used. So what exactly is this spot map and when was it used? It was now in the year 1848 to 1854. Okay, many people in London were dying. Okay, that prompted an epidemiologist to investigate. That epidemiologist name was Dr. John Snow. Okay, he was the epidemiologist. So he took the map of London. So what I have drawn this circle is a London map. Okay, I'm sorry for the thing. So he took the map of London and he realized that the whole London was not getting affected. The cases were seen only in one particular area. The deaths were not across the whole of London. Only one particular area the deaths were happening. That area was called as Broad Street area. That area was called as Broad Street area. What was wrong in that Broad Street area? In the Broad Street area, the people were using water from a hand pump. They were using water from a hand pump. This hand pump, this hand pump had Vibrio cholerae, and Vibrio cholerae will definitely cause cholera, and this cholera was responsible for the deaths. Okay, landmark, the first epidemiological study, very landmark is one. Hence, John Snow is called as father of epidemiology. John Snow is called as father of epidemiology. And cholera is called as father of public health. Both are MCQs for you. Okay. So John Snow is considered father of epidemiology, and cholera is considered as father of public health. So this is an example of local variation. That means the whole city was not dying. It was only one particular area from where the deaths were happening, and that area was called as Broad Street. And in that area, the people were using hand pump to draw water, and that hand pump had got contaminated with Vibrio cholerae, and responsible was obviously cholera, and the death because of cholera, and hence cholera became father of public health. And John Snow, because he did the research, epidemiological survey, he is called as father of epidemiology. Now, this is about place variation. These place variations are also called as geographical variations. Logic, no? Simple, isn't it? These are also called as geographical variations of disease. Okay, to depict all geographical locations. This is also another MCQ. Okay, to depict all geographical location variations. Depict means how do you show it? Okay, map diagram is used. Map diagram, also called as cartogram, also called as cartogram, is used. Okay, for geographical variations, we use map diagram. Okay, whether it is international variation, national variation, urban rural variation, or even your local variation, for all these things we use only map diagram. Okay, now any doubts are there for you, please feel free to ask. In place variation, any doubts are there? Any doubts are there? Or should I go for the person variation? Very less is there. Any doubts are there in this? Examples of place variation. Hey, Dr. Vaishnavi, this is all place variation. International variations, national variation, rural urban variation, local variation, these are all variation. How is spot map different from cartogram? Hmm, see, cartogram, you will take a specific area. You can take a map of India and then mark those areas of where fluorosis is there, isn't it? So there is national variation. Spot map is used only for one local area, local variation. Okay. Anything else? Nothing. That's it. I'll go for the next one. I'll go for person variation. I'll go for person variation. Okay. Now, when it comes to person variation, okay, you have your case history. Basically, how does the disease vary according to age, gender, isn't it? And like that. So, age is what? Now, I am going to give you examples of age versus dental caries. What is the relationship between it? Okay, the relationship is as age increases, dental caries also increases. Okay, now why does this happen? This happens because with old age, your occlusal surface gets worn out. So coronal caries decreases, but at the same time, your root exposure increases because there will be decrease in the manual dexterity. Okay, Since there is decrease in the manual dexterity, the patient will not be able to clean their teeth properly. Hence, root caries is more. So I did not say coronal caries. I said dental caries, isn't it? So remember this: as age increases, dental caries also increases. The same with even age versus the chances of periodontal disease also. With increasing age, there will be increased chances of periodontal diseases, and of course increase in the oral cancer also, because the immunity decreases. Okay, then what about fluorosis? That's the fourth dental disease that we have to know. Remember, the critical age for developing dental fluorosis is birth to 12 years. That's it. Okay, this is the critical age for developing dental fluorosis. Dr. Nidhi, with increasing age, what happens? Tell me. Your saliva secretion reduces. Your manual dexterity to clean your teeth reduces. Isn't it? Chances of gingival recession increases. Periodontal disease increases. Yes or no? So root exposure happens. So once the root is exposed, cementum is exposed. Cementum is less resistant to caries attack compared to enamel. So the root caries increases. Okay. Okay. The critical age for developing fluorosis is only birth to 12 years. Now, for you or for me, we cannot have, even if we consume more than 1 ppm, we will not have dental fluorosis, because fluorosis is a developmental disorder. And birth to 12 years is the most critical age for development and maturation of the teeth. Once that is done, you cannot have dental fluorosis. Okay. Now coming to gender, how gender varies. Okay, gender, how does it vary? Okay, with respect to gender versus dental caries. Okay, this, no, it is in some research it has shown that whether you are male or female, it does not make a difference to develop dental caries. Some have shown males have more caries, but majority also have shown females having more caries compared to males. Females having more caries too than males, and the reasons that are given are: number one, more fondness of sweets. Okay. Number two, early eruption of teeth. So if there is early eruption of teeth and sugar exposure is there, caries are more chance, isn't it? Chance of caries are more. What about then next? Hormonal variations. And of course, lastly, morphological variations of teeth. Okay, so because of these reasons, they say that females have more caries. With respect to gender versus periodontal disease and oral cancer, definitely males. Overall, males will always have more compared to females, which I'm sure Dr. Sagar has already covered this for you, right? When it comes to gender versus fluorosis, okay, it is found more in males again compared to females, and the probable reasons that is given in your literature is delayed eruption. So the more time a tooth takes to undergo development and maturation, more and more fluoride can be incorporated. So delayed eruption and maturation, and water consumption, more outdoor activities among boys, and hence there will be more consumption of water, more outdoor activities among boys, hence more consumption of water. So more water you consume, more fluoride you're consuming. More consumption of water containing fluoride. Okay, these are the gender variations. Apart from that, they have given about occupation, marital status, socioeconomic status. Socioeconomic status, I have to tell you. Please remember that only one, that MCQ point of view is socioeconomic status versus carries. Okay, please remember carries is now, carries is more among lower socioeconomic status people. Hence, now caries is called as disease of poverty. Why it is found more among lower socioeconomic status people? The reason is they have got more access to sugar, but they don't have access to preventive and treatment care as the rich people do have. Okay, so hence it is now considered as disease of poverty. Okay, so this is about the third step, that is variation of the disease according to description of the disease according to time, place, and person. Should be more than a respect to MCQ. The fourth step, if you remember, I had told you in this, it is called a measurement of exposure. Now you are interviewing the people from when do you see these kind of symptoms. Okay, so you are trying to measure the exposure. Don't worry, no MCQ will come. Then the fifth step is called comparison with known indices. Now, a descriptive study that you do, you can you can make it into a cross sectional study, or you can make it into a longitudinal study. Now, what is the difference between them? Now let us go back to our incidence and prevalence. Cross sectional study are also called as prevalence study. That means your aim of this descriptive study was only to find out how many people are suffering, prevalence, how many are suffering from the disease, and how is the disease distributed in the population. Okay, but you can go one step further. Apart from knowing how many are suffering from the disease, you can do follow up for them, so that you can eventually find the cause of the disease also, why the disease is spreading. Apart from giving only risk factors, it will also throw light on causal factor. It depends on the investigator. In the beginning, only the investigator would have written it. This descriptive study, as of today, I am going to do only cross sectional, but I might go and do follow up for that study later and convert it into longitudinal, so that I can find the cause of the disease. Okay, so that is what is called comparison with known indices. And then after doing this, you will also compare your results. Compare your study results with other populations. Why will you compare your study result with other population? So that it will throw light on risk factors. Why did you get the result like this? Why in your study only males were affected? In the other population, females were affected. In the other population, both males and females are equally affected. So you need to justify, isn't it? So you need to compare your study results with other population. Okay, so that will throw light on risk factors and eventually help you to formulate hypothesis, which is what is your, this will eventually help you to formulate hypothesis. All, what is hypothesis? Now this is the question. What is hypothesis? What is hypothesis? What is a hypothesis? Means are supposition, assumption, okay, preposition of a thesis is called as a hypothesis. You are assuming something, you are prepositioning something, you are supposing something. That is what is called hypothesis. What is the ideal example for this? Take yourself only. Example, your own example. If I study for 4 hours per day for the next 1.5 years, I might top the All India rank. Only a hypothesis. Yes, whether you will get or no, only time will tell. Yes, only time will tell, isn't it? There might be another person who's studying 5 hours per day, he might go and top the exam, isn't it? So we do not know it. So it's you're formulating. So point is here, the key word is if, might. If I go 2 hours early, I might get to see the match from the front seat, like that. Somebody else would have already gone 3 years before. You never know. So you're formulating a hypothesis. So this hypothesis has to be tested now. So how do you test it? So this is what is another MCQ. Remember this. Okay. Uh, so for testing of hypothesis, you will have to conduct an experimental epidemiology or analytical epidemiology based on your resources, based on your time frame, everything. Okay. First is we will prove it through analytical, and then if you can also do it through experimental. Experimental is the best. I've told you that. Okay, you want to prove something, nothing like experimental. Okay, nothing like experimental. First is obviously analytical, then we will go through experimental. So tomorrow we will be going with analytical epidemiology, early morning, case control. So many MCQs are there. Case control cohort that will take around 1 hour. I'll give you a break. Then randomized control trial. In that again, parallel randomized control trial, crossover randomized trial that will take 1 hour. Then half an hour for screening as well as scales of measurement. Association will take 15 minutes. If I have time, we'll go tomorrow. Otherwise, on a Tuesday. So as of now, I am concluding the class. Any doubts are there for you? Any doubts are there for you? Are you able to understand what all have been taught to you? You have to go through. Okay, not today probably, but tomorrow. Once the class is over, let the match get over. On probably on Monday, you can, if you are of course interested in cricket or not, it's your prerogative. Any doubts are there for today's class? Any doubts are there? Very good, very good. There is a boy in your group in your WhatsApp who has written, "Repetition is the mother of all skills." I am really impressed with it. The quote. I'm trying to tell the students this particular point. Many of them don't understand. What do you mean by repetition? See, this is the first time you're listening my lecture. Correct. After the lectures are over, community lectures, you will be given time to read on your own and then solve the MCQs. The more times you will read it, my notes, okay, the more better you will get it. You will not have confusion. If you read only once, trust me, and try to solve your MCQs, probably today you will get it. After 1 month, nothing will be there in your mind. So repetition. You have to revise once again and again to make yourself perfect. It's like you're cutting your cavity. For the first time when you do, you might get a wonderful cavity, or you might cut a very bad cavity. The more and more you practice, the more better you will get at cutting the cavity. The same logic is for MCQ exam. There are 19 subjects. Each has its own importance and advantage. Depends on you actually. So much we will tell. So much information is given to you. You have to utilize it for your own benefit. That is all I can say. Okay. You will not find as simple as this that I've done it for you. Okay. So all I'm saying is now the ball is in your court. Okay. You have to read. I can't read for you. I can't write the exam for you. You have to do it. You want a government seat. That is why you have joined so early. You want a government seat. Mark my words, you are in a best position to do it. Okay, the information that we are providing you, you will, if you read it that much, more than enough, more than enough. If you revise it well and go, read the notes, class notes that is given to you. Trust me, you will do wonders for yourself. Okay, these class notes you will not find so simple in anywhere. You will understand when you solve MCQs, especially for epidemiology and statistics. Okay. Anyway, let me not bore you. So tomorrow morning I'm going to see you all again at 8:30. Hopefully you'll come. 8:30 is the time for tomorrow. Okay. Thank you. Thank you once again.